Hello, I'm Dr. Kojin, and we're here with movie star Steven, and we're going to do some cheeks on him. So we're using Juvederm. It's a hyaluronic acid, of course. I did this side on him, and so you can see he has that beautiful Nike swoosh arch. So this is what models look like. Models have a 3-point promontory: prominence, prominence, prominence. All attractive people have an upside down triangle on their face. This is the zygomatic arch right here, as it is here. And so we're just creating that same mid-face volume to create the 3-point promontory on our movie star here. So what I did with him here was I went in medially, 45-degree angle, sub muscle, okay, on top of the periosteum, okay, so submuscular. And so my handout shows 1 and then 2, which is in the mid-pupillary line. You go in and you fan it, and then you see that beautiful little bump he has, which I just made. You can see the fresh needle marks. This is perfect. This is a nice cheek augmentation using Juvederm. And it has to look like natural. It has to look like the natural zygomatic arch, which is here. If you see, the zygomatic arch has fullness medially, midline, and laterally. And so we're just recreating that. You can see the 3-point promontory on, Herman, the model for our skull. So now we're gonna do the same thing on this side. Here we go. So I'm gonna get some gauze. His face has been cleaned. You ice before if someone's prone to bleeding, but ice is good for pain. Now make sure that you put the needle on really tightly. I've explained this in other videos that it has to be cinched on. Cinched on. You see there's still room. Now it's cinched on. Okay, so this is a needle. You can use the needle that it comes with, it's fine. And so we're going to create that same volume that models have to give them that more 3-point promontory. So number 1 is medial. So you're gonna go in here. See, you don't wanna put Juvederm in the tear trough. You cannot put Juvederm in the tear trough. Nurses shouldn't do tear trough filling. Doctors do tear trough filling. The tear trough is a very complicated area. The only filler that can go in the tear troughs is Restylane, which is 20 milligrams of hyaluronic acid. You can never put 24 milligrams of hyaluronic acid, which is Juvederm, in the tear trough. What that means is the tip of the needle should be 1/2 inch away from the tear trough. Why 1/2 inch? Because the needle is 1/2 inch long. So watch. I want the product to lay right here at the zygomatic arch, okay? Not in the tear trough. So I'm gonna go in 1/2 inch below, 45 degrees. You go in and you push the plunger, and as you're pushing, you're retrograde linear threading, you're pulling back. So that takes very little, it doesn't take a lot, but the approach is 45 degrees. If he had nasolabial folds, which he doesn't, but if he did, then I would do 5 degrees. There are other videos I've done on nasolabial folds that you can watch. So this is 5 degrees, 1/2 inch, 1/2 inch, 1/2 inch, using Juvederm to do the nasolabial folds. But when you're creating volume, not filling wrinkles, you go in 45 degrees, submuscular on the periosteum. So now you see the flatness there. So now we're gonna do the fanning technique. You're gonna go in 1/2 inch away from the tear trough. I'm touching the bone right now. I'm going to inject, pull back without going all the way out, change, add more volume, pull back, change the angle, add more volume, and inject. And you could see that fullness that he got in the mid-pupillary line, which is, similar to the fullness he has here in the mid-pupillary line. So we did 1, we did medial, we did midline, and now we're going to do lateral. So we're going to go here, Again, on the bone, push. Another injection on the bone, inject. On the bone, inject. And on the bone, and inject. And that's going to give him that lateral arch. So we've used almost all of it, and now you could see that that's a very anatomical way of doing it. I got it. That's a very anatomical way. You can see how it mirrors the natural bony arch of the skull, and you can see how now he has a perfect three-point promontory, a perfect upside down triangle of beauty. The other things is that the anterior posterior projection of the zygoma is now in front of the plane of the orbit. Before we started, the cheek was as flat as his eye, but hold that, stop the bleeding, yeah. But what you want is, you want the zygomatic arch, in front of the eyeball, not the same plane as the eyeball, so that in the lateral view, the zygoma or the cheek projects in front of the eyeball, and in the anterior posterior view, or in the frontal view, that creates that three-point promontory, prominence, prominence, prominence. So this is cheek augmentation using filler. The products I like to use for cheek augmentation is Radius. Number one, that's my favorite. You get 1.5 milliliters of calcium hydroxyapatite. The other fillers that are good also are, Juvederm, any of the Juvederms, the Restylane family like Lift and stuff, that's fine also. Voluma, of course, is very good because that lasts almost 2 years. Things you don't want to use are the, really fine fillers that only last a few months, and there's a bunch of those out there. But this is cheek augmentation, so let's take a look at it one last time. Okay, so there he is, perfect. So you just see now that he has this nice prominence. It doesn't look too much, it doesn't look too little. And then go ahead and turn for the camera, and then you can just see, then you can just see that little Nike swoosh he has that he didn't have before on both sides. And now you have a perfect triangle. Triangle, triangle, triangle. And that's how you create a beautiful face. The paradigm of beauty is symmetry and contrast, symmetry and definition. So the brain likes to see a body that's chiseled and defined, likes to see a face that's symmetrical and chiseled and defined. And with fillers, we can make the face a little bit more chiseled and a little bit more defined, creating that upside down triangle of beauty. I'm Dr. James Kojan. Thank you.